video. This week, the Department of Health has released the initial findings from its Whole Systems Demonstrator program. Now, the program was launched in May of 2008, and it was intended to test the effectiveness of telehealth and telecare systems for those in the community. Now, more than 6,000 people across Newham, Kent and Cornwall have been involved in the trial, and the Department of Health has released the initial findings from the telehealth side of the program. With me to talk about the results is David Cockayne, the UK Health and Social Care Director for Tunstall Healthcare, which has been providing the equipment and services for the trial. Welcome, David.
Good to meet you.
Firstly, the results are positive. For example, 45% reduction in mortality rates. You must be happy with that.
Yeah, I think it's a great success for the trial, and these are just the initial results. Everyone's excited to see later in the year what it might look like at some detailed level. But in terms of an impetus for the NHS, this really justifies the clinical case that our organisation and many others have been working on now with, in our case, over 85 organisations in the UK. So I think it really gives a great clinical backing to what we've been trying to do.
So what is this going to do though? We've had talk that telehealth works for years. Is this going to change anything?
I don't think overnight there's going to be a huge change in the marketplace, and certainly people are going to be running out saying, let's do this tomorrow. What I think it does do is for those programs that are in place, and I said before, there's a lot of programs in place, some small, some at larger scale, it gives another backing to what people are trying to do. So those commissions have already gone forward, tried to do things a bit differently. It says to them, look, and to their GP and their commission colleagues, this is the evidence, this is proven it once and for all, within the UK, it works. Now the question is, how does it work for your health economy? And that's where the real learning and the expertise comes in, I think.
Right, okay. What about the money? We've had people say that it's just too expensive for trusts to fund the capital investment. What's Tunstall going to do about that?
Well, the first thing, for many years, we've not been looking for an initial capital investment. There are many other models that you can do around there, particularly around looking at revenue, looking at risk and reward. Our chief exec this week have been talking about how we want to look at financial partnerships with organisations. We've entered into some of those around the place before. Now, don't get me wrong, some trusts do still have capital and still looking to invest in that kind of way, but that's really an equipment type of purchase. What we've been doing for many years now, in partnership with NHS organisations and local authorities, is to say, look, we want a long-term strategic relationship with you. That means we need to have some skin in the game with you. We can't expect you to say up front, here's loads of cost. We've got to share in the benefits. We've got to share in some of the downside too. And that's really what I think the Prime Minister's talking about, or he says a partnership between industry and the public sector. Right,
okay, you mentioned the Prime Minister in there. He's obviously announced that they're going to get telehealth services out to 3 million people over 5 years. Is that what's needed here, a central approach?
I'm not sure he's dictating a central approach. I think what he's saying is he wants a target in the sense of something for us to attain to. If you think about the NHS at the moment, something like half of the appointments for GPs are caused by long-term conditions, 70% of the budget of the NHS is taken up by long-term conditions, and a huge amount of bed days in hospital. I think what he's trying to say is, look, let's have something that's aspirational for us to work towards and to say we all should be involved in this. This affects a huge amount of the British population, which is a burden on both them in terms of their outcomes, but also in terms of the economic state of the NHS. And that's why I think he's trying to say, look, let's aim high. This is not about trying to pilot this 100 times again.
Right, okay. So let's talk about timeframes. Started in May 2008, and it's a while ago, and now we only just have the initial findings from telehealth. Yeah. It's obviously frustrating for a wide range of people, but is it frustrating for Tunstall as well?
I think it's, for many people in the industry, it's frustrating it's taken so long, but I think you need to look at what have they attempted to do. They've not wanted to rush out and publish something which says, look, early findings are this, we need to do more work. They've held back and said, look, 7 academic institutions have looked at this. They've looked across 3 different sites, different economic factors in each site. So Cornwall, for example, where we're very embedded in telehealth and telecare, is all about a very rural, quite poor population there compared to some other parts of the country. If it works there, it works in Kent, it works in Newham, we've then got a really robust case. So I'm pleased that they haven't rushed to produce something which then gets knocked down. I'm pleased they've got something that's very robust, that all clinicians can look into, they can explore the data and actually find something which works well for them.
Yeah, haven't actually seen that though yet.
No, we haven't seen that, but I feel confident that if the Prime Minister, Secretary of State and the 7 academic institutions that have released those early findings are so proven that they'll go with a 40% reduction in mortality rate, that's outstanding. And those kind of numbers replicate what we see and other organisations see in the current programmes that are ongoing at the moment.
Okay, thanks. Thanks, David. That's all we've got time for this week, but EHI will be keeping a close eye on the government's any further announcements they've got to make on this, and also their 3 Million Lives campaign, which we mentioned in there. In the meantime, though, as always, check out our news pages for more in-depth coverage.